In late February, 175 biotech executives met at this hotel in Boston for a two-day conference. Little did they know, it would soon become the first example of a superspreader event in the United States. The leadership conference was organized by Biogen, one of the biggest biotech companies in the world. Its executives flew in from around the U.S. and abroad to attend the gathering. By the end of October, as many as 300,000 coronavirus cases in the U.S. have been linked to the conference.
This was a time when we didn't realize that you could pass on the virus even before you had symptoms. You could pass on the virus if you had symptoms that were no more than a common cold.
Dr. Lemieux is one of 50 healthcare experts and researchers who contributed to a study on the conference and other Boston superspreader events published in the journal Science.
To track the spread from Boston, researchers took samples of the virus from 28 people who had attended the conference. They all had the same strain, one that had not previously been seen in the United States, though it was seen in Western Europe. That strain then traveled to 29 states and several other countries.
The study estimates that by the end of October, the conference was responsible for nearly 2% of all cases in the U.S. Biogen came under fire for hosting the event at a time when others in the industry canceled theirs. In a statement, the company said, "We hope that information gleaned from these data will help continue to drive a better understanding of the transmission of this virus and efforts to address it." In March, it announced a $10 million donation to COVID-19 relief efforts in the U.S. and abroad that includes money for testing. Dr. Lemieux says it's important to focus on the lessons learned.
I think that the conditions that would allow for this type of spread to occur are still with us. And we really need to remain vigilant, avoiding large gatherings, using the masks, using physical distancing.
Karina Huber, CGTN, Boston.